Hi everybody, it's David Porter, and today I want to talk about chemical dependency and something which has been seen very consistently is that 90% of the population can drink alcohol and take it or leave it. That same percentage of the population can indulge from time to time in other psychoactive substances and for the most part take them or leave them. 10% of the population will only be able to take them, and they will take them way too often, way too much. A smaller subset of that 10% will use compulsively, and for the purpose of simplicity, I'm going to confine the current discussion to ethyl alcohol, although this applies to most other psychoactive substances that produce a dopamine reward chain. That is, boy, that was good, don't forget, go get more. That's a dopamine reward chain. Boy, that was good, don't forget, go get more. Reward and reinforcement behavior, which is reinforced, tends to be repeated. Psychoactive substances that agonize dopamine, that is, enhance dopamine, will be especially likely to create that dopamine reward chain. So, back to ethyl alcohol, drinking alcohol. About 90% of the population can take it or leave it. About 10% is going to take it, and a smaller portion of that 10% will only be able to take it. Or as AA says, alcoholics drink the way they do because they cannot drink any other way. There's a small subset of the population genetically predisposed towards dependence on alcohol, and they will continue drinking though it's rendered their life unmanageable. The three main features of alcohol dependence or alcoholism are, number one, very high tolerance. People who are dependent on the drug ethanol will be able to consume quantities which would render another person of about the same body weight unconscious or dead. This is a 1.5 liter bottle of water. I know people who drink this much of a distillant, that is a distilled beverage, typically cheap bottom shelf vodka. People who will put away this much every day. Now, I have all I can do to finish 1.5 liters of water unless it's about 95 degrees out. Imagine this were vodka and drinking this much every day. I know people who do that. I have patients who do that, and they're killing themselves. That amount of alcohol would kill the average individual. I weigh more than I care to admit currently, 274.5 pounds to be exact. There is no way I could drink even 1/4 that amount of alcohol without getting very sick. And if I tried drinking more than that, very likely I would end up in a coma and would be at risk for respiratory depression and respiratory arrest and cardiac arrest, followed quickly by cardiac arrest. So imagine you have tolerance like that. That's an indicator of dependence. Criteria number 2, if you stop drinking alcohol, you are going to experience withdrawal symptoms. That is, not just psychological withdrawal symptoms, cravings and desire for the drink, but physiological withdrawal. You will get tremors, first noticeable in your fingers and your eyelids. If you ask a patient to close their eyes, look at their eyelids, it'll look like their eyelids are vibrating. You will experience agitation, insomnia, irritability, anxiety, restlessness, and in some individuals this can progress to grand mal seizures, epileptic type seizures, and a psychotic episode where people will experience a departure from reality, objective reality, and hear voices and see things that are not there. And generally, these are called DTs, delirium tremens. And if an alcoholic has a history of DTs, that produces neurological kindling in the brain, which is going to increase the probability of them having DTs again in the future if they get into a cycle of heavy use and then sudden cessation. The third criteria, and yes, I know there are more criteria for chemical dependency in the DSM, Diagnostic and Statistical Manual of Mental Disorders, currently up to the 5th edition. By the way, quick sidebar, widely regarded as the absolute worst edition of the DSM that's ever been produced. Anyhow, you are going to have a third main criteria, which is life is going to become unmanageable. You are going to be experiencing regular, severe consequences and every day in terms of your physical health, your psychological well-being. You're going to have financial problems, probably problems with the criminal justice system, difficulty with work and school and daily functioning and social interaction. Your life is going to unravel and become unmanageable. Despite this, the compulsion to drink alcohol is going to remain. Because everybody, here's the thing with the 90%ers. That is, again, the people who can consume alcohol from time to time and will overdo it from time to time, but it does not render their life unmanageable. The 90%ers have an off switch in their brain. You pour yourself a scotch neat or on the rocks, sip it, might take you a half hour to drink it, maybe you'll have another one. And the next day, the only thing that's changed in your life is you have less scotch in the bottle and you have two other glasses to watch. And that's about it. To wash. That's about it. For an alcoholic, they're not going to be able to have one or two scotches. They're going to finish the bottle. And then maybe they're not done yet. They're going to go out and try to get more alcohol, meaning that they're going to be driving under the influence. They may do who knows what in terms of reckless, impulsive, irresponsible behavior while under the influence of alcohol. And for an alcoholic, there's no such thing as one. AA also says 1 is too many and 100 is not enough. And that is a very accurate statement. Once again, that dopamine chain of, boy, that was good, don't forget, repeat it, do it again. People are going to do that with everything from barbecue potato chips and chocolate to large amounts of ethanol, again, if you're genetically predisposed. So that's just a brief rundown on a much more complex topic. And, you know, I guess a personal message is you really want to know if you're in that 90% or 10%. If you're in the 90%, treat alcohol with respect. Treat it as a complex beverage and drink it for a taste experience after your responsibilities are concluded for the day. Please don't touch car keys or a firearm. Those are the two most likely ways you're going to have a problem, even if you're a 90%er. If you're a 10%er, you are not going to be able to drink. You just won't be able to drink. If you try, your life will become unmanageable. Seek professional assistance if you meet any of the aforementioned criteria of high tolerance, withdrawal symptoms upon cessation of use, and compulsive use despite adverse circumstances. Okay, everyone, thank you for watching, and please hit subscribe. Be safe.